Charting Toward Intimacy covers mature topics. Listener discretion is advised. Charting Toward Intimacy covers mature topics. Listener discretion is advised. Hey there, welcome to Charting Toward Intimacy, where we're expanding the natural family planning conversation. I'm your host, Ellen Holloway. In this episode, I am joined by Nora Pope, retired naturopathic doctor, and Dr. Jessica Liu, a practicing naturopathic doctor. And we spend a little bit of time discussing those kind of burning questions about why NFP, why fertility awareness isn't more well known in the healthcare field in general. So I'm so excited that I got to have this conversation with these two fantastic women. And they also talk a little bit about a session that they have coming up for healthcare professionals to learn about fertility awareness. So they're just doing some incredible work in the field. And I'm so excited to share this conversation with you all. Okay, I'm so excited. We are welcoming Dr. Jessica Liu, Naturopathic Doctor, and Nora Pope. Thank you guys so much for being here.
Our pleasure.
Thank you. We're excited.
Thank you, Ellen.
So could you guys just start out by giving us a little introduction to who you are and a little bit about your history in this area?
Sure. So I've been a cycle charting and fertility awareness advocate and user since 1994. And then in 1998, I began naturopathic medical school in Toronto at the Canadian College of Naturopathic Medicine. And I was the only student in the class in 1998 who knew about cycle charting. So it's been part of my mission to weave it in the naturopathic world. And then I graduated in 2002 and I was in practice until 2019. I closed my practice and now I'm focusing on teaching healthcare professionals about cycle charting, progesterone HRT, and curing infertility whenever possible. And the website is www.fertilityce.com. And our next webinar is February 26th. That's me.
That is amazing.
And I am a naturopathic doctor in Mississauga, Ontario in Canada. And it's great to be here. I've been in practice for over 15 years. And my whole journey into becoming a fertility-focused practitioner started out because my own menstrual cycles were all over the place. And I was at a loss. And so it was through naturopathic medicine, working with herbs and acupuncture and changing my whole nutritional, microbiome and gut health and all these wonderful things that I was able to get my cycle back on track. And then just 4 or 5 years ago, I took Nora's course. She did a course for naturopathic doctors in cycle charting, and it changed my life, changed my practice, and we just haven't looked back. And so we're really passionate about spreading the word and teaching people how to have this beautiful awareness just through just knowing your body.
That is amazing. And from what I understand of the story, she's basically lured you over to partner with her in this. And
oh yes, it wasn't a hard sell. It's my sincere honor. This woman is a female physiology savant. She's like a walking encyclopedia. You probably don't even know what an encyclopedia is.
Young. I'm not that young.
But I know it's been just a joy, and delivering this course and to educate other healthcare providers who are interested in restoring fertility is really a mission for us.
I think that's so fabulous. And it's something that is absolutely missing just in our medical world is that education about the fertility cycle. And so I just love that you guys have created this course and that it is your mission to reach out to doctors and help them learn about how incredible all of this is.
Thank you.
So before we dive in, I did want to ask you guys to explain kind of the difference between a medical doctor and a naturopathic doctor, and just kind of so that we're all on the same page.
Well, I think in some jurisdictions in the US, naturopathic doctors are also called naturopathic physicians. And so really our training for the first couple of years is exactly the same as medical school. We do all the diagnostics, we know all the lab tests, all of that stuff, the physiology. the biochemistry, is we have that knowledge. So we're sort of medically trained, but we're naturally focused. So we're going to use nutrition and treating the root and, looking at optimal levels of things as opposed to just baseline, the difference between you're in pathology or you're just okay. We're interested in really helping people thrive with education. So that's why cycle charting is so important here. It's about empowering our patients to know their bodies well. And so we'll also use acupuncture and herbs and homeopathy. And there's all these wonderful tools that we have that Mother Nature has given us to be able to, really truly elevate the health of our patients.
And progesterone, HRT, very, very important.
That's right.
So, a lot of couples who are struggling with fertility, sometimes the woman might be low in progesterone, but often the progesterone is poorly treated, or poorly tested. A lot of women are told to test their progesterone on day 21 of their cycle. And the goal is to test mid-luteal progesterone, or, the halfway mark after ovulation. And what we teach in our course on February 26th is how to really learn when the woman is ovulating. And we teach about the estrogen time of the cycle and the progesterone time. And you test right in the middle of that progesterone time. It's called peak +7. And naturopathic physicians can prescribe progesterone in many jurisdictions in North America. And we really like the human identical progesterone or the bioidentical progesterone. And so that's a big goal of the course that we want to teach: proper testing, proper measurement, proper dosing, and then proper assessment.
Right. Because for so many people, like testing on day 21, maybe they just ovulated. Like day 21 might have been ovulation day for them. And in which case, getting lab work done on that day, not going to be all that helpful.
Exactly. You understand, because you're a charting professional yourself. We need more people like you, Ellen, teaching people cycle charting. So thank you.
I was just having a conversation with a friend of mine about this, and we were talking about low progesterone and what that 21 day lab is. And I was like, well, it's not actually day 21. It is peak +7. You find your peak day and then schedule it, couple days after that. Anyway, we could keep going in there, but I have some questions I want to ask you guys about doctors.
Yeah.
So why is it? Why do you guys think it is that doctors just don't know very much about fertility awareness?
I think part of it, it's sort of it's human nature to dislike something you don't know. So the quick answer is that there's very little exposure in mainstream medical schools about cycle charting. The impetus in sort of family planning in medical schools is pregnancy avoidance. So you're not learning about the body. You want to prevent pregnancy. That's the sort of the thrust. So how do you prevent pregnancy? You use barrier methods like the diaphragm or the IUD, or not the IUD, but the condoms, or you use hormonal contraception like the IUD or the oral contraceptive pill. And that's what they learn about quite well. And sadly, the effectiveness of fertility awareness-based methods are very underplayed, because all it takes is a couple of badly designed studies, and then you throw a wrench in the works. And some studies are badly designed because they'll do, let's say, phone interviews, and how did you prevent pregnancy in the last 30 days? So at the end of the day, there's no sort of discussion on the standardization of the method. And what happens is statisticians get very nervous about effectiveness when you don't have, consistent method effectiveness or use effectiveness. And you need a properly designed study to be consistent, use the same method, ask the same questions, and you need more than 30 days. You need to learn a method. You need to learn a method. A good teacher needs about 90 days to teach a couple how to naturally regulate their fertility. It's not something you learn overnight. And so I want to give a plug to Dr. Margaret Duane at Georgetown University. And she teaches an elective in fertility awareness-based methods.
Oh, that's amazing.
It's very, very popular. And so there is a growing number of medical doctors that are interested in, the natural regulation of fertility. And I think in naturopathic circles, like I said, in 1998, I was the only one that knew about cycle charting. Now, Jessica, I'm going to put you on the spot. If you walked into a naturopathic classroom, how many do you think would know about charting?
I think the awareness is much better. And I think that, our job is to first do no harm. And so to know your patient, this is like a tried and true, this is an established method to learn as much as you can about a woman's physiology without invasive testing, right? So for naturopaths, this is where we would excel, right? Because our job is to first do no harm and to look at the root and to analyze and really use those symptoms as a piece to the puzzle, right?
Well, it definitely just like, it feels like it fits like a perfect puzzle piece into like a naturopathic doctor's approach to anything. So it makes perfect sense in that world.
But I'm very excited. Every year, more and more medical doctors are interested in the restorative approach, for obstetrics and gynecology, because cycle charting lends itself to a restorative approach to dealing with infertility. I want to give a nice shout out to Dr. Jerome Check. He runs a very busy fertility clinic in New Jersey and Pennsylvania. And he has published a lot about the use of bioidentical or human identical progesterone. So I want to thank him for all his work. But also he's pioneered the use of low dose amphetamines to restore fertility. And now this is being picked up by the restorative doctors that I know to restore fertility. So I do see a growing interest in really learning about the woman's physiology. And so I'm quite optimistic for the future. And so we're teaching these off-label drugs in our course because I want to help naturopathic doctors and any healthcare professional to really be able to uptalk with fertility clinics around the world with the latest developments. And in terms of being a naturopathic ethical treatment, we believe in the minimum dose. What is the minimum dose? And you have interesting drugs like low-dose naltrexone, low-dose Clomid, low-dose letrozole, and now low-dose amphetamines to help restore fertility. I'm very excited about that. And you need the cycle charting to properly time these meds. And then and to properly time acupuncture. And
That's right.
So can you talk about the 4 phases of TCM and how it's modeled on the 28-day model?
That's the thing. I think for teaching purposes, a lot of schools, even acupuncture schools and traditional Chinese medicine schools are still using the 28-day model because it's nice and neat and tidy, when really we should be teaching our med students that only 13% of women have a 28-day cycle, right? It's not necessarily the ideal if you understand what are the healthy biomarkers that we're trying to achieve. 5 days of red flow, 4 or 5 days of beautiful white flow, right? Post-peak phase that is stable and consistent. And so in Chinese medicine, it's important to understand, when you can understand where a woman is missing in these healthy biomarkers, does that mean she's yin deficient? Does that mean she's blood deficient? What kind of points would you choose pre-peak and post-peak? And that's what we're trying to get that messaging out, that you can think of a woman's cycle in these ways to be able to really fine tune your treatment plan.
Wow, that is fascinating. Oh my gosh.
Yeah, no, there's a wonderful book out called The Fifth Vital Sign, written by Lisa Hendrickson-Jack.
Oh yeah.
And she really is a wonderful advocate for presenting the menstrual cycle as a fifth vital sign. And I think the goal in our course, fertilityce.com, is to present healthy biomarkers, for guiding the clinician to achieve a healthy outcome for our patients. So like Dr. Jessica said, we want 5 days of menstrual flow, or we call it red flow. We want 5 days of cervical fluid. We call it white flow. And you want that consistent post-peak phase because it shows consistent progesterone function. And we want to make these terms media friendly because let's face it, if you say cervical mucus on the air, it's ick. And Ina May Gaskin is a midwife I adore. And she was on TV on ABC News talking about natural childbirth. And she says, now, if a woman's in labor and you're rushing her, the sphincter reflex is going to kick in and she's going to stiffen up. And the anchor went white. And he turned to his producer.
He said the S word.
And he said, can we say that on the air? Like, you could tell the look by his face. So you can't say certain words in the media. So that's why we're using the term red flow and white flow, to make it media friendly and to help with fertility literacy and body literacy. So
we want women to be able to celebrate that, right? Like,
right.
that to have that in their language, to say, I'm proud of my white flow. I'm proud of my cervical. It was 2 centimeters. It was, 2 inches. It was so stretchy. And that's beautiful for us. Like, where I'm jumping up and down in my office when a woman who's never had that experience finally notices what that feels like. It's like, yes, we hit the jackpot, it's celebratory, because this is something that women should have as a marker for their health, right?
Exactly.
We want to achieve that. Yeah.
Yeah. And our bodies are so good, and they were designed so good they were designed to be good. Like, all of these things about our fertility cycle are very good. And so, yeah, I love the idea of celebrating that. And there's so much stigma, even just around the word, like, period. It's like we're embarrassed to say that and stuff like that. So I totally get what you guys are doing with making, media friendly words and just,
like on our Instagram account, we say red flow is your friend. Like, if you have red flow, that means you're healthy. And we say white flow makes babies. And we want to just educate in a friendly, fun way, as much as we can. And
right.
then,
and that's a great place to start with, like, young girls too. Of just like, red flow is your friend and white flow makes babies. Like, that is very easy to, like, understand for, I'm imagining, like, a 9 or 10-year-old who really doesn't need to get into, like, the nitty gritty on, like, what different hormones are fluctuating and, what exactly is going on, all this kind of stuff. But it's like, if they can start to understand that basic concept and notice those 2 things happening in a cyclical manner, I mean, just how much more well-versed would our culture be in our own natural and good fertility?
absolutely. So that's what Fertility CE really, that's one of our goals, is to really change the culture slowly, as you say. But I like the name of your podcast. You call your podcast Starting Towards Intimacy. I really like that because, I believe what I see. And when I'm helping couples learn about the menstrual cycle and basically the shared fertility between men and women, I see the light bulb open up in their eyes. And then also there is a newfound appreciation for the body and for intimacy. And I see it before my eyes over and over and over again. Men and love learning about cycle charting. They really, really do. They get very, very, they bond closer with their female partner. And I really love it. So I love the name of your podcast.
Thank you. Yeah, I mean, that's exactly what we were going for, is there's so many different levels of intimacy. As you begin to better understand your own body, you become more intimate with yourself, more intimacy with your spouse in just the understanding and the communication, intimacy with, like, friendships, being able to share and talk about these things in open ways. Yeah. Anyway, we could, maybe I should do an episode where I talk about why we titled the podcast Charting Toward Intimacy.
You hit upon a really interesting point too. Like, in Chinese medicine, that spark of conception is really about a woman coming into her own authenticity. It's like getting really clear about who she is at her core. And that energy is what makes that ovulation spark. And I could talk for years on that topic, and I love it. So you've got something special there with your message. It's awesome.
That's awesome. Okay. So, back to kind of talking about doctors and fertility awareness and that world. I would agree with you. I feel like there is so much kind of hope for the future that, like, this is starting to become more mainstream, and that's amazing. But as for, right now, right here and now, what kind of suggestions do you have for the best way to approach the subject with our doctors right now, who, especially ones who are kind of negative toward fertility awareness?
Well, I think here, then you have to present fertility awareness as a medical tool. It's a roadmap to help the woman, time her blood tests, time her ultrasounds. Then you get a real accurate reference range for these important reproductive hormones. And then it guides the clinician to how to dose the necessary medication, whether it's botanical, nutraceutical, pharmaceutical, or acupuncture, and also how to time ultrasounds. We talk about this in our course at fertilityce.com in terms of using the chart. You start with the chart. It's your roadmap to time for assessment, treatment, prognosis. And the chart will change over time. You will get more of that white flow. You will get more of that red flow if you had scanty menses. And that will indicate that the lining of the uterus is healthy and that the follicle is healthy and the corpus luteum is healthy. Mm-hmm. And you will know you're on the right track. And then, but more importantly, especially for hormone replacement therapy, we teach our students when to time the progesterone. And I'll say it here, peak +3 to peak +12. Very, very important. Very, very important, because you want to sync up the treatment in cooperation with the woman's physiology.
Right.
So when you present it that way, saying, dear doctor, I can't prescribe progesterone, let's say, but this is the research on how progesterone can maintain a pregnancy. How can it prevent miscarriage? How we can help healthy outcomes and healthy birth outcomes. This is the data. This is the ideal reference range. And can we work together? And I think that's how you encourage people like you who teach it and for your patients and clients to be an advocate. Mm-hmm. And you show a solution to the medical doctor rather than saying, why aren't you doing this? You just say, we've got answers. Let's work together. You present the conversation as win for the patient, which is what any clinician wants.
And it's data, right? Doctors are interested in helping their patients if there is sufficient data to justify the course of action. So when you come to the doctor with 3 months of beautiful charting and you say, this is so clear that there's something off with my cycle. I don't want to wait 12 months to be told I'm not fertile and then to begin the investigation. I want to start now because I've been able to see consistently that something's not right. Mm-hmm. That's a tool, that's data that client can then present to their doctor.
Mm-hmm. Right? I think that's beautiful. Like really using the knowledge that we are gaining through charting our cycle to partner with our doctor. It's not about telling our doctor they're wrong for trying to prescribe us birth control. It's about saying, look, I have this knowledge and I'd like you to help me figure out, what is wrong or what we can try to fix. And I need your help, because who doesn't want to help?
Exactly.
Especially a doctor, because like they, by prescribing birth control, they honestly think they're doing the best thing for you. And so just helping them understand that the best thing for you is going to be, digging into your chart and identifying what it is that can be fixed in that way instead. Mm-hmm. Mm-hmm. I love that. Can you tell us a little bit about your experience with working with doctors who don't know very much about fertility awareness and then learn about it? Has it been positive? Have you been met with a lot of negativity? What has that experience been like?
Well, I remember, I used to practice in Toronto. I practiced naturopathic medicine from 2002 to 2019. And sometimes I'd have patients drive from North Bay, which is 5 hours north of Toronto, and because they wanted to do cycle charting. And their local medical doctor was thrilled to work. And I said, these are the ideal blood tests. This is what we're trying to investigate. So you want to do blood tests on day 3 of the cycle. You also want to do blood tests pre-peak for estrogen function and post-peak for progesterone and estrogen function. And they were very, very, very happy to proceed with those blood tests. And again, if you just show the cycle, show the chart, and show, explain the physiology, it was a very positive experience. And sometimes some doctors say no. But at least, there are doctors who, if they have a curious inventiveness about them and they want to help their patients, they absolutely are very interested. And how about you, Dr. Jessica?
Yeah, I would agree. I think there's certainly, I've worked with some medical doctors who believe in the restorative approach but it's a laborious process. So if a medical doctor has the ability to partner somebody like yourself who's fully, engaged and has that expertise, then it alleviates their job to have to dig into that chart. You've done the work for them, right? So then if you can just present, this is the data, this is what we're seeing. What are your thoughts on testing here and testing here? What are your thoughts on a little bit of supplemental progesterone from peak days here and here, right? So this gives them like a system to tap into, right? You're supporting that collaborative space. So I'm hopeful that there's going to be more doctors who'll be open to this type of collaboration.
Yeah. Well, and I think the place that it starts is all of us who are just going to our doctors to talk about it more, like make it mainstream in the doctor's office to mention your cycle and mention your charting. I saw this hilarious little comic, and it was a woman sitting in a doctor's office, and the doctor just asked something like, how is it going? And the woman was like, well, I was feeling pretty down yesterday, but I was like peak +8. And so I realized that I was definitely had really high progesterone and was just feeling kind of down. And then, after another week or so, I started feeling a little bit, and she just starts talking about her cycle, and the doctor's like, what?
But there are more organizations. I mean, there's the Fertility Care organization, and they have doctors trained all over the world. And then there's the Marquette system that have trained doctors. And there's Femtech. I mean, there's more and more organizations that are getting the word out. And so again, it's like Horton Hears a Who, the Dr. Zeus cartoon. And we're all in Whoville. We are here. We are here. We are here. And we're in that puffball. And boy, the nice elephant is going to save us and just get the word out. Horton, here's Horton. So I think, I'm optimistic. And, just for the students, well, I shouldn't say students, the healthcare professionals registered for our course, we have midwives that are registered, pharmacists, physiotherapists, naturopathic doctors, and we're investigating getting accredited in the United States as well for American doctors, so like medical doctors. So it's these are baby steps, but I'm very happy, and onwards and upwards. So
that is so fantastic. Oh my gosh, this has been such a fun conversation. Was there anything else you guys wanted to add before we kind of close out?
Sure. Our course is on February 26th. And it's an all-day course, and it's been accredited for 6 CE credits for pharmacology and obstetrics and naturopathic care. And it's being recorded on February 26th, and it's going to be uploaded, and you'll have access to the show, the unlimited recordings for a whole 12 months. And that's included in the price, fertilityce.com.
And that link is going to be in the show notes, everybody. So if you're curious about that, or you want to send a healthcare professional that in that direction, awesome. Dr. Jessica, was there anything else you wanted to add?
I just think, this is about, women speaking up for themselves, right? And men, this is, body literacy is empowerment. So when you can own your health and know the ins and outs of your body, this is where change can happen on the level of globally. How can we help, like you said, our girls grow up knowing their cycles, knowing that when their cycles are heavy or delayed, that, the answer might not be to jump to A, B, or C drug, but to look at other ways nutritionally to shift that, right? Before it becomes an issue of infertility. If we could start that sooner, that would be great, right? Because that is the restorative approach.
Absolutely. Oh my gosh. There have been so many fantastic things that you guys have said. And there have been quite a few things that you guys have mentioned, books and doctors. And so links to all of those are also going to be in the show notes for all of you listening. At least I hope I'm going to find links for all of those.
We've got them.
Oh my goodness. Well, thank you so much, Nora Pope and Dr. Jessica, for being here and sharing your experience and expertise. Thank you so much.
Thank you for having us.
That was
so fun.
Thanks so much for listening. Again, links to a lot of those things that we mentioned are going to be in the show notes. So check that out if you're interested in learning more. And if you're interested in directing any healthcare professionals toward that course, I'm sure it is going to be phenomenal. If you are not already following us on Instagram, please come find us at Charting Toward Intimacy. I'd love to connect with you. And also, if you are listening in Apple Podcasts, I would be so appreciative if you could rate and review the podcast. It really helps us be findable for other people. And we'd love to just get the word more out about natural family planning and the conversations we're having around that. Until next time.